Hi, I'm Armin Budish, and I'm here for Cleveland State University, the Levin College, and we bring you insights into the current issues that we're dealing with as a community. We've experienced two major healthcare crises here in Cuyahoga County and around the country. One is the COVID pandemic, and the other is the opioid crisis that we've faced, and we're still losing people every day. People are dying from overdoses, getting sick, and we have two of the lead experts on how we deal with this crisis and how we treat the people who are facing this crisis. So we have Dr. Patty Stoddard-Dare, who is a professor here at Cleveland State, and she's nationally known for her research on substance use and mental health disorders. And we have Brandy Carney. Brandy is the Director of Public Safety and Justice Services for Cuyahoga County and a 2001 graduate of the Levin College here at CSU. And she's been the point person for the county on the opioid issues. So thank you both for coming in. Would you just give our audience a little bit of background for yourselves?
Yeah, so I'm Patty Stoddard-Dare. I'm a professor in the School of Social Work. I've been at CSU since 2006. I helped to create the Chemical Dependency Counseling Certificate Program at CSU, and I still enjoy that work. And I'm also the director of the Women's and Gender Studies program.
Great. Brandy?
And again, Brandy Carney. I am the Director of Public Safety at Cuyahoga County and Justice. I oversee organizations such as our County Emergency Management Office, as well as the Countywide 911 Center. And in addition, as you stated, I am responsible for the opioid funds that we received at the county as a result of the settlement a few years ago.
So you've been the drug czar.
I've been the drug czar.
So to speak. All right, Dr. Dare, Patty, you've created a curriculum for best practices training people on how to deal with treatment. Can you talk about that?
Yeah, absolutely. So I am housed in the School of Social Work, and I partner with the Council on Social Work Education, which is the accrediting body for all social work programs in the country. And we work to establish evidence-based practices for teaching substance use disorder counseling skills to social workers and to other individuals who are interested in getting training. And so we have two different pathways that students can take. A lot of people are interested to know that they can take just one class. It's a class that I designed and I teach. It's called Theories and Procedures in Addiction Studies. And after they complete that class, they can apply through the Ohio Chemical Dependency Professionals Board, and they can receive a professional endorsement to be a chemical dependency counselor assistant, and that's a preliminary endorsement. And with that education and with that professional endorsement, they can work as a recovery coach in our community.
So you mentioned others can take this. Can police take this course, and would that be helpful for police who are called out to an incident and need to deal with an emergency situation for somebody who's suffering from an opioid problem?
Yeah, absolutely. This course is designed for anybody, but it would be wonderful for police as well. I have been working with for the last many years the Police Assisted Addiction Recovery Initiative. PARI is what it's called nationally, but locally it's called Safe Passages. It's where police officers, they voluntarily kind of embrace a philosophy that they're going to be working with individuals who have substance use disorders, not just to try to prosecute them and arrest them and put them into jail, but also to partner with them, understand where they're coming from, and help assist them into getting into treatment. So individuals who are, the police officers who are part of the Safe Passages program, I think would be ideal candidates to take the CDCA class.
And we've seen more and more police departments sending out either social workers with the police or the police with instructions about, being careful about, you don't take everybody to jail. If they're having a health problem, you deal with it as a health problem.
Yeah.
And this course can help.
Yeah, absolutely. The course can definitely help. We have had teams go out where it'll be like someone from like the squads and then police officers and then also a social worker that go out as like crisis response teams. And so anyone who can get some of that background knowledge on some of those intervention skills to working with people who have substance use disorders is helpful when we're in those situations. But oftentimes police are the first responders who are intervening with not even just individuals who are struggling with substance use disorders and who have overdosed, but also like with their family members. And so it's helpful to have some baseline counseling skills to assist in those interventions.
Brandy, you've been integral. You've been the lead on creating the diversion center for the county. This sounds a lot like something that the diversion center's been working on. Tell me about the diversion center.
Sure. Yeah, this is really great information to hear. I'm so glad that we can work together moving forward. So a few years back when we received our settlement money, we identified as a priority for the county opening up a countywide diversion center. And so
what is a diversion center?
Sure. So the main mission or goal when opening the center is to divert individuals who have a substance use disorder and or a mental illness, severe mental illness, into treatment rather than jail. So our mission was, rather than police officers taking someone to jail when they might have committed a small nonviolent crime, for example, instead to provide those individuals with the help they need to get better for their long-term recovery. And so the diversion center that we opened allows law enforcement to drop someone off, immediately serve those resources on site. So again, addiction services and or stabilization for mental illness services. And our goal is to then link them up with either longer term care that we can transport them to after their time at the diversion center and or a longer term program for that individual to keep them in recovery.
So police officers have limited time. They're fighting crime and crime is up, so there's a lot of time that's needed. How long is this training program? How long would it take a police officer to go through this curriculum?
It's only 40 hours. So is
that enough time to really
it's enough
learn
time
enough?
It's enough time to learn more than you knew before. And so what students report to me is that it was really impactful and that they learned a tremendous amount. So the class is actually offered as an online class. It's a 3-credit class, and people can sort of go and complete the work at their own pace. And they find that, I mean, my students are reporting to me that they are engaging with it even more than they thought they were going to, because they find the information so helpful in their daily practice with whatever facet of social work practice that they're in. But for a police officer, I've worked with a lot of them in the past, and the information is very helpful and it's very relevant.
So we bring this broadcast to you to bring information to the public, but just as a sideline, we can bring people, experts together who can help each other, and that's what may be happening right here as we sit here today.
True.
That's great. So, Brandy, how is the diversion center going?
It's going well. I was just there before I came here today. We have 50 beds at the facility, and what's nice is an individual can immediately receive treatment. Often individuals, when they're ready or need treatment, it might not be available for them, or they might not have insurance, and so there might not be a bed. So rather, other than just the officers that can bring someone, anyone needing these services can receive the services at the diversion center. We're open 24/7, 365. We have an entire staff of a medical staff, a psychiatric staff on site, as well as peer coaches and counselors to help with some classes and tools for the individual, as well as people that have lived experience, that have been there before, and so it can help the person that's receiving those services feel more comfortable. It is completely voluntary, so no one, if a police officer brings someone or if they bring themselves to the center, they don't have to stay, but we encourage them to stay, and there's really amazing staff that work with each and every individual. And I think our our average time for people to stay right now is 5 days, which is really great because the longest time we usually have anyone stay is 7 days. It's that immediate acute part that we do at the diversion center and then can hopefully transfer someone to receive other longer term care. So 5 days is really good.
That's why I want to stop you at the transfer to receive other care, because I remember when you were exploring this diversion center concept, calling around to treatment programs all over the place, everywhere you called, to try to find how many beds do you have, how many beds are open. Nothing was open. I mean, most places had like one bed if they had anything, and it was a real problem. And so
not only did I have such a challenging time finding out beds open, but just what the facilities were, what services they provided. Finding all that information and finding, the bed information was really a challenge for me, someone that has, staff that can help support and the resources immediately available. And that was a challenge for me, definitely.
So in conversation with Patty, I discovered that Patty has done huge amount of this work. Tell us about the website you've created.
I'm super excited about drughelp.care.
We've prepared
drughelp.care. We've prepared a short introductory video about drughelp.care if we want to take a look at it.
Absolutely. Let's take a look at it right now.
Drughelp.care is a free community resource designed to help those who struggle with substance use and addiction find treatment services. Listing more than 500 treatment services provided by over 100 verified agencies across Northern Ohio. Over 100 different search filters to help people find treatment that matches their individual characteristics and needs. Find available treatment slots in real time. View search results on an interactive map. And locate peer and family support services and available harm reduction resources. Visit www.drughelp.care to start your search or register your treatment agency. Created by students, faculty, and staff of Cleveland State University.
So that's a very, very helpful video that you put together, and it's right on the drughelp.care website. Tell us more about the website you created.
Well, we're super excited. It's actually an initiative out of Cleveland State University, and it came to us from hearing from people with substance use disorders in the community who were having difficulty connecting to an open bed during the time when someone was amenable to receiving treatment. And so we worked with hundreds of community members and community groups in order to develop this website, which has an ability to show us where are the open beds, and then also to help people to match treatment to their individual needs, which was something that was just really missing. And one of the critical parts of it is that it really allows social workers and other counseling professionals to be able to repurpose their time away from calling around trying to find a bed into working directly with patients.
So I would imagine somebody goes in to a treatment center, is there for, might be a week, 2 weeks, a month, whatever it is, and then they leave. That creates an opening. How often do you update that website?
So we send an email out to all of the different treatment agencies, and they get to say whether they want to receive the email every day or if they want to receive it once a week. It depends on the type of service. So some of the different types of services, like inpatient beds, we really need to know if there's an opening. But some other types of services, they have sort of infinite number of openings, so it's not as important to have a daily update. And so they can receive the email either every day or once a week, and then it actually only takes the agencies, the provider agencies, 2 minutes to provide an update, because they just literally click plus, 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 or minus, 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 how many beds do you have available, and then they could say how long the wait list is. Like if they have a wait list of, let's say, 5 days, then they could put that on there as well.
Armin, if I could, when
Please.
I looked at this website, they, in addition to having the bed availability, just having some of the specialties that they list for each individual location was really amazing. Like every individual has unique needs, and being able to find something that might be more specific to that individual, whether it be psychiatric care or whatever the need is, was really amazing. I've never seen it before in all my research and work, so really great job.
Thank
really
you.
Great resource.
I do think that we're unique because we do have 100 different search filters, and we really asked the community. We asked community members who were struggling, we asked their family members, and then we asked the agencies that are providing care, what type of calls are you getting? You know, like when you have a mismatched call, who are they that are calling and you're turning them away? And they'll say things like, well, it's a pregnant woman. We don't take pregnant women here. Okay, that let us know we need to have that for a filter. I would get calls. I'm not sure what's the best placement for a client with schizophrenia. Okay, now we have that as a search filter. And so what we do is we have in-depth interviews with the agencies as they're registering their services. So we ask them about all those different 100 different search filters to see if they have specialties in different areas, and then it allows individuals to find that treatment placement that is absolutely tailored to the individual client. So they can search by things like gender, and they can search by insurance status, and they can search by previous types of co-occurring psychiatric disorders or the types of medication that they're taking, whether or not they have certain types of criminal justice history that can actually be a barrier to finding placement. They can search for all sorts of different things in order to be able to find like that perfect placement for that client. And again, this can be done with doing a search online using drughelp.care in like a couple of minutes rather than spending a week and a half calling agency to agency trying to find a place.
I can guarantee you, Brandy did not spend a week and a half. She spent months doing this.
Yeah. It's not as fun as it sounds.
No, it wasn't.
So all this great information is on the website. It must cost a fortune when you go on and you want this information. How much would it cost me to go on the site?
It's free. It's free for people to use. Yeah. So we've been really lucky because we had some original funding from the Woodruff Foundation, and now we're funded through the Centers for Disease Control and Prevention, and they're funding our website right now. So it's free for agencies to register their services, and it's also free for people struggling with substance use disorders and their family members and their friends to use this service as well.
That's great. So, Brandy, you've had a chance to look at the website and go through it carefully. What do you think?
As I stated, it's really great. I haven't seen anything like it before. I asked a number of questions with Patty and her team, and she had answers that were immediately available at my fingertips for all of them. And just as I mentioned before, you know, when someone has this need or an individual's family member has a need, you know, it's often an immediate need. They're ready to seek some treatment. And so we want to make sure that that resource can be immediately available to them. So streamlining that process, you know, we joke about making all the calls, but unfortunately when someone's on the other end, it's not that easy. You know, it's unlikely that they're going to still, you know, want to go if they're calling around for days to find something. Yeah. So having that's really a great resource, and I'm really thankful and know I'll be using it for locations in the future.
Fantastic. Great to hear.
Free, too.
Yeah, it's free. Yeah,
free.
It's life-saving. I mean, that's the bottom line.
Yeah.
Is that
Absolutely.
When you can shorten the period of time from when someone is amenable to treatment to being able to get them into treatment, you're actually saving someone's life.
Absolutely.
And we know inside Cuyahoga County in particular that, you know, this is a real problem, and we have, you know, some of the highest overdose fatality rates in the country. And so
yes.
if we can shorten that time frame for anybody and increase their chances of successfully beating their substance use disorder, then we've done a great service.
So the diversion center was set up to divert people out of the criminal justice system. And we talked about police bringing people there instead of to jail. Can anybody else go to the diversion center, or does it have to be somebody that the police pick up?
No. So again, the police, the initial mission of the diversion center, as I mentioned, is keeping people completely out of the criminal justice system. Sometimes even going to jail for a few days could really wreak havoc on someone's life for a long time, and it might just be because of a mental illness or a substance use disorder that individual has. But fairly quickly on, we realized that we have a lot of beds and a great resource and a wonderful staff, lots of medical care and counseling staff that are there and available. So we did open up the doors so that anyone can in fact use the center. They can call at any time and come to the center and have the resources there on site for them.
So you don't need any connection to the criminal system.
You do not. Anyone can come and use the resource if they need it. And we've been really successful. If an individual comes, their average, as I mentioned before, has been 5 days, which means that they've stayed there willingly and received those services. We usually have around 30 people there per day recently, which is really good when you think about the turnover of individuals that happens when you're only a facility that keeps people 5 to 7 days max. So really knowing that we're providing these service to people and going in there and hearing some of their stories has just been really just so great to hear, and a good feeling for me. And you know, the fact that nobody sees a bill when they come in, nobody receives a bill. If you don't have insurance, that's okay. These services are available for you, and there's people for you. It's been a really great project to be part of.
Also free.
Also free.
We have
Also
a lot
free.
of free today. All right. And the county has been doing a great job. So the county filed a lawsuit against the manufacturers of the opioids that are killing people, and
the county has County Executive Armin Budish at that time, yes.
And now there's a new county executive, Chris Ronayne,
That's
who's
correct,
carrying
yes.
on very well. So how the county got something like $120 million, if I recall. So you've helped direct where that money goes. Where's it going? Is it going to some of the programs that Patty's got on her website?
Sure. So we received approximately $126 million at that time. And as you can imagine, since then, there's been lots of requests for the funding. So we initially, early on, identified diversion as a priority and have since funded many projects that have a nexus to diversion. And so we funded projects for recovery services, for harm reduction services, for education services, really the whole gamut. We even ended up finding a program that we're moving forward on now that is an innovation fund for opioids. So kind of outside of the box thinking of new ideas or new resources that might not be something that we do every day, but we know that this is something that's impacting everybody. There continues to be lives lost, so we really have to identify other opportunities for, or maybe we can hopefully find a cure or help mitigate some of the deaths that are happening right now. So we've done a number of different programs that we've put the money towards. Regarding the website, you know, we just met recently, and now I know that it's there, and so I'm not sure if it's an opportunity, but I would love for it to be.
Tell me how you got started on this website, by the way. I think we sort of skipped over that.
Yeah, via my research partner, another professor at CSU, Miyuki Tidor, we attended a community meeting where it was like an open forum. I think it was hosted by the Addiction and Mental Health Board, and people were saying what they felt like they needed in the community. And one of the things that they said that they needed was to be able to find available treatment beds. And so Dr. Tidor, after that meeting, she said, "We're going to do this."
And what kind of feedback have you gotten?
I mean, wonderful feedback. I mean, just absolutely wonderful feedback. I mean, people are very appreciative. I mean, we built drughelp.care for the community with the community's input. And so there was never a mismatch between what the community needed and what we were offering, because we were intentionally tailoring drughelp.care exactly to those needs. So it's been pretty great. And if you offer something for free, people usually like it.
At least the price is right.
Yeah. And so, I mean, our goal is just to make sure that that all the people who need to know about it. That's always going to be the goal. And then to continue to have funding so that we can make it available.
The drug overdoses and people with a drug abuse problem, often that overlaps with mental health issues.
Yeah.
Does the website have anything to help people with that?
Yeah, so right now we list the co-occurring disorders, so other mental health disorders that people have struggled with, so like schizophrenia, you know, depression, anxiety. And so it's really designed right now for someone who has a substance use disorder and another disorder. But, you know, if we had enough funding, we definitely would love to expand that.
Well, I'll tell you, you know, we've been hit with these two huge public health crises.
Yeah.
COVID, obviously, people are aware of, but the opioid epidemic has been awful for Cuyahoga County and Northeast Ohio and all over. Yeah. as we've heard, what the county's doing, what you're doing at Cleveland State are critical to helping save lives.
Yeah.
And so I, first of all, thank you for what you're doing for our community, and then I thank you for coming in today and filling in our audience, and maybe we'll see you guys working together. Thank you very much.
I would love that. Thank
Yeah,
you.
this was great. Thank you.
Thank you. Thank you for watching.